Yeah. Yeah. It's interesting because I've had a patient who got very sickly, felt really bad doing testosterone replacement. And there's a lot of inflammation in his body. So that's exactly kind of what you said. If you haven't calmed the inflammation, you haven't helped the body to be in a more steady and calm state, and then you put this amplifying hormone in the body, then is amplifying everything.
God, I'm so glad you mentioned testosterone because everyone wants testosterone. I'm like, who said
Right?
it's even
Men
your
and
issue?
women. Yes.
Who said it's even an issue? In fact, now you have hypertension. Now you're taking medication to block the effects of the testosterone. Now you're giving blood because your blood's too thick. Like, what? It's its own train that went off the tracks, and yeah.
Well, it's a very popular subject because people want, they want to increase lean mass, decrease fat. They want to, feel energetic. Of course, the sexual function, it's very popular. So,
Yeah,
like, in what cases would you give people testosterone?
yeah, and I'm not against testosterone for sure, not, but appropriate. So let's give an example. So with men, when I work with men, if they have a belly, we have to get rid of that first, right? Because that's estrogenic, and that estrogen is pushing testosterone down. So if you're before I start giving you, let's see what your body produces. When I get rid of that estrogen belly that you have going on there that you call a beer belly, but when I call it estrogen belly, they don't like that so much, right?
I like
What?
it.
I have an estrogen belly? What are you talking about? So we get rid of the estrogen belly and you start lifting a little bit of weights, many times the testosterone starts elevating by itself and we don't have to introduce. But I certainly have patients where in month number 3, they're doing the work, they lost the weight, and their testosterone is still not budging. That's a great candidate for testosterone. I believe in bioidentical hormone therapy that's applied daily. I don't like injections that bring you up and then bring you down. It's not my jam, just putting it out there. I think we want to keep you kind of steady daily because then we eliminate like emotional labile and just outbursts. Um, so that's what I like to do. And for women, women need testosterone also, but with them sometimes it's the opposite. Sometimes it's elevated and it looks normal because it's like if you post. Let me just explain. Post hormonal women should be like at 0 testosterone. If you're 65 and you're walking with a testosterone level of 30, you're eating a lot of carbs. We have to figure this out, right? So before I start talking to you about estrogen and progesterone, I know we stuff about testosterone. I have to see what that looks like when you don't have all this insulin resistance going on. So now for postmenopausal women, if it's at 0 and they're feeling symptomatic and we did the work, for sure I'll get on testosterone. Again, bioidentical hormone therapy and topically, and I think it's great. So yeah, there's a room for it. But what we do now is just like, oh, you're tired? You have muscle pain? Here you go. Here's some testosterone. No one cares about your high blood pressure. No one cares about your how thick your blood is, right? It's
What
fine.
is
Just
the
keep it cool.
recommended dose range for testosterone for women, right? So it was like,
Yeah, like
I remember
point
it was about
0.5 to
35.
4. Like so it's like 0.25 to 1 milligrams a day topically. And for men, you start at 25 milligrams.
Right.
And that what you're getting when people are getting injected is way higher than
Mm.
that. And it's concerning. It's concerning because then they come to me in my primary care practice and I have to deal with their blood pressure being high and where do they go to do phlebotomy to get rid of the thick blood that they have because now they're high risk for a stroke or heart attack, all because of testosterone. So they're chasing a different loop. That testosterone loop, what happens is, oh, I feel achy. Let's give you some testosterone. Initially, that first testosterone you get that first month, you're going to feel amazing.
Mm.
Then you're going to keep spending the rest of your time on testosterone, that kind of testosterone, chasing that high, which you're never going to get again because that's not your problem. The problem is not your testosterone level. These people's testosterone is like over 1,000. It's clearly that's not the issue anymore. If you're still achy and not feeling well and the libido is an issue, can't possibly be testosterone if your testosterone level is at 1,000, right? So for some reason, that's lost on them.
Yeah. Yeah.